Assalamualaikum. We are CS2593A students and we're gonna present to you AI versus COVID-19. So before we start, let me introduce you to our presenters. IRFAN SYAFI, SHARIFUL ZIKRI, me myself, NATASHA AISHAH, FARAHANI and also SITI NURJEHA. Let's start with the introduction. What is AI? What is COVID-19? And how AI going to fight COVID-19? COVID-19, coronavirus, is a type of virus which has caused a global pandemic of respiratory illness. This disease has emerged in China in December 2019. AI, artificial intelligence. AI is a developing computer program to complete tasks which will require human intelligence. So, before we go deep into how AI fights COVID-19, we're going to talk about the history of AI. ICHT, Intelligent Referral System for Primary Child Healthcare, was developed in order to reduce children mortality in rural areas. This system succeeds in catering the pediatric common complaints by taking into consideration of fundamental risk factors such as immunization, weight monitoring, developing milestones, and also nutrition. Other than that, we have HERMES, Hepatology Rule-Based Medical Expert System. HERMES is an expert system that predicts critical disease which related to liver.
Assalamualaikum and hi, I am FARAHANI will present about the identifying imaging risk. So generally, artificial intelligence AI has an important role to play in the healthcare sector. However, it is important in the face of a pandemic like COVID-19 right now that is even more significant and works by combining AI with the knowledge of epidemiologists who are able to identify how and where to look for evidence of imaging risk. Viruses of COVID-19 are commonly spread by the close contact with those who are infected and have the symptoms that happen mostly in a confined or crowded places. AI has been combined with other technologies to track and flag possible carriers of the virus. They also adopted AI for detecting people with fever in large crowds by the use of AI-powered smart glasses that worn by security guards where they can check hundreds of people within a few minutes without making any contact. This proved to be an effective method because manual measurement is kind of time-consuming and would increase the risk of chain of infection. For example, Blue Dot, a global AI database company that uses outbreak risk software, combined their health and medical expertise with advanced data analytics to build solutions that track, contextualize, and anticipate infectious or disease risks. It is to identify the imaging risks from COVID-19 and warn its client to avoid Wuhan province and takes almost 10 days to send out by the World Health Organization (WHO). So for your information, according to Blue Dot, the projected annual global cost of COVID-19 is $1 trillion. So if the Blue Dot warning message had resonated around the global 10 days before the official warning from the WHO, governments could have started implementing preventive measures earlier and have the preparation to overcome the crisis.
Assalamualaikum warahmatullahi wabarakatuh. I am Siti NURJEHA and I will present about one of the roles of AI for COVID-19, which is to enhance social distancing. To make sure that the virus does not spread to others, distancing ourselves from other people could be one of the way. However, this way cannot always be maintained in densely populated countries where access to basic resources is already a daily matter of life and death. Artificial intelligence able to provide enhancements to social distancing and could also assist overburdened healthcare system. For example, in China, sophisticated surveillance technology are used where the facial recognition and body temperature to identify whether individuals has a fever or therefore might be a carrier of for this virus. Although detectable, this method always allows for early intervention before an individual begins to show some noticeable symptoms of infection. Other than that, in China, robots that are typically used in catering industry are used to clean, sterilize, and deliver food, and medicine to reduce human contact, where transmissions of COVID-19 could be also avoided. Then there is also the use of applications and big data, which can identify and assess risk based on individuals' history, how much time they spend in virus hotspot, or potential exposure to people carrying the virus. People are assigned a red, a yellow, and a green color code that can be accessed through popular apps that indicate whether they should be quarantined or be allowed in public. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I will explain about the use of AI in initiating drug discovery. First of all, AI is used to initiate drug discovery against COVID-19 virus. In Silico Medicine, a biotechnology company based in the USA was able to use their integrated AI-based drug discovery pipeline to generate new drugs compounds against COVID-19. Secondly, AI is used to fast-track drug development. A Chinese scientist successfully sequenced COVID-19 genome in just 1 month, which usually take up to several months to achieve. It is an accomplishment for the AI industry. Last but not least, AI can help to identify useful drug for the treatment of the COVID-19 patient. It also has become a powerful tool for diagnostic test design and vaccination development. So, AI is very useful in initiating drug discovery.
Assalamualaikum warahmatullahi wabarakatuh. I am ZIKRI. I will talk about offering alternative method to healthcare. The partner COVID-19 screener provide a simple, straightforward chat interface presenting patient with a series of questions. In this way, it too can screen enormous number of people and rapidly differentiate between those who might really sick with COVID-19 virus and those who are not sick. Most importantly, this thing can also serve a near instantaneous dissemination method for supporting our widely distributed providers, as we have seen the need for frequent clinical triage algorithm updated based on a rapidly changing landscape. For the second point, smart field hospital is monitoring patient at hospital reduce a direct contact. China's Wuhan Wuchao Hospital established a smart field hospital staffed largely by robot. The idea of humanoid robot taking jobs previously done by human may feel dystopian, but in the midst of the global COVID-19 pandemic, robot can free up human medical staff and limit the possibility of virus spread. The robots, some of which are more humanoid than others, can clean and disinfect, deliver the medicine to patient, and measure patient temperature. For the third point, no contact infrared sensor system. One way in an eye detect coronavirus is with camera equipped with thermal sensor. Hospital and public health facility is performing real-time temperature check. Thanks to startup Chronic Care and with a smartphone and thermal sensor. The eye system developed by Chinese tech company Baidu that use an infrared sensor and AI predictable temperature is now used in Beijing station. To detect for head temperature of up to 200 people in a minute within a range of 0.5 degrees Celsius. The system alert authority if it detect a person with a temperature above 37.5 degrees Celsius, since fever is a telltale sign of coronavirus. That's all from me. Thank you.
For conclusion, significant technologies of AI is a vital role in COVID-19 global pandemic, as it is being used in so many ways to fight COVID-19. Thus, we must be quick to apply machine learning expertise in several areas so that we can achieve a world without COVID-19. But don't forget to wear your mask and frequently sanitize your hands. #we take care each other. Thank you.